Hi, everybody. We'd like to welcome you here today to our exclusive interview with Dr. Lisbeth Roy, founder and medical director of Dr. Studio here in Boca Raton. Dr. Roy has been a contributing writer to Fabulously 50 Plus magazine, and we are lucky to be in her beautiful office space discussing women's wellness today regarding maintenance, non-surgical solutions to any issues that women may have. So I'm going to turn it over to Dr. Roy.
Great. Well, thank you very much for coming in and doing this. I think women absolutely need to know that they have options. 50% of women actually have sexual dysfunction, and it can range from vaginal dryness to decreased sensitivity, to just lack of libido. There can be pain, all kinds of issues that, believe it or not, ladies, are easy to take care of. And so women have been told by their gynecologists and their primary care doctors that there really isn't any help for them. And so I'm very, very happy that you have come here so that we can spread that message. We take care of all kinds of women. All kinds.
I think that what we have found is a lot of women are very reluctant to talk about their body, to talk about sex, even with friends, gynecologists, or significant others. What would you say when someone comes in to talk to you? How would you relax them a little bit to discuss these issues?
Well, this platform is perfect for that, actually, because we need to start this conversation, and this is a very non-threatening way to talk about it. Women do talk about this among themselves. Unfortunately, they don't share that with their doctor because they have been told just year after year that there's really nothing for them. We have one FDA-approved medication that works for some women. It certainly doesn't solve all of the problems, but there are lots of different options. And while we're talking about sexual dysfunction, I also want to bring up urinary incontinence, because women, even young women, have issues with leaking urine. We just blipped, so I'm just going to repeat that. Sometimes it's an urgency with urinary incontinence. Sometimes it's what's called stress incontinence, where if you cough, you sneeze, you jump rope, and you're actually leaking. These are big issues. They're very, very big problems, because these problems don't get better unless you actually intervene. And with urinary incontinence, for instance, it's a progressive issue. If you are leaking urine now, 10, 15, 20 years from now, it's going to be worse unless you do something about it. So we're starting this conversation. Thank everybody. Thank you for joining us. I have just recently released a book. Actually, we haven't even formally released it yet, and it's called Regenerating Sexual Potential, and it's available on Amazon. One of the reasons I wrote this book is because women and men don't know all of the options that are available to them, and unfortunately their doctors don't either. So I wanted to talk specifically today about what some of those options are, and how to find your way to somebody who really can help you.
So how simple are these options? We talk about...
Good.
No, we were just talking about incontinence. We're talking about a bunch of other things which we are going to discuss. How simple is a solution to that? How is that process? When will somebody see results? It's also interesting because there are hormonal changes in women's bodies, and I think a lot of us think that this could be premenopausal, postmenopausal, but actually, you can tell me, but age, like you were just saying, may not matter.
Right. In some cases, certainly age does matter, because we have the degeneration of tissues, we have hormonal changes, we have babies, we have all kinds of issues. The truth is there are several different technologies that I want to talk about today. One is platelet-rich plasma. We're hearing a lot about platelet-rich plasma. It is here to stay. This is just not a fad. A lot of doctors and patients think this is just a fad. It's not. It is a regenerative technique that is very easy to do in the office. I draw your blood, I process it with some special equipment, and then I inject it in the affected area. It doesn't hurt. It is simple to do. It is very safe. No one has ever been harmed using platelet-rich plasma. And women will typically see changes within a month. And that is a big deal. So if a woman has urge incontinence, for instance, if she just has the feeling that she has to urinate all the time, There's very few medications that help. This is called an overactive bladder. There's very few things that actually help. A platelet-rich plasma injection, in my practice, in my experience over 6 years of using this, solves the issue within a few weeks. Solves the issue. And I've had women with real serious urge incontinence where they just think about urinating and they're standing in a puddle. This is not a little drip. And we get full resolution of these issues. Lots of reasons why I think that's happening. We won't necessarily go into it here, but know that that's possible. There is another technology called ThermiVa. You might also be hearing a lot about that. ThermiVa is a radio frequency, which is a great technology we're using for skin tightening and aesthetic purposes. It was initially introduced as labial tightening, so we were thinking aesthetics. What we have found is that it works incredibly well to revitalize the tissues intravaginally as well as the labia. So if a woman has dryness, lack of sensitivity, thinning skin due to hormonal changes, the ThermiVa can really stimulate a regeneration. We have a tightening of the introitus as well. Who doesn't like that? And then, of course, we also will do the outside of the labia, and you have immediate shrinking. So women, believe it. So here we are. There's so much to talk about. We're going to have to do a lot of these things, right?
We are.
Yeah. So there's not just function, but women are actually self-conscious about what they look like. And when you don't have a lot of hormones around, or if you've had some babies, or maybe even poor nutrition, then the skin on the labia gets saggy and droopy, and it's not pleasant. And women are motivated to change that. And ThermiVa does that. And what I do in my practice is I combine technologies. So when a woman comes in and she has severe vaginal dryness, pain with intercourse, she has no libido, the labia are saggy, for lack of a better word, she'd like the whole thing just re-engineered. That's right. I'll combine radiofrequency using ThermiVa with platelet-rich plasma and some very safe, very protective, life-changing bioidentical hormone therapy. We'll do that in one visit, and within weeks there are major changes.
We have a question that came in just right to that topic, Dr. Roy.
Okay.
How many treatments do you get, would you have to do of that ThermiVa or PRP to get that, for that aesthetic result?
So that's a really good question. The ThermiVa is typically 3 treatment sessions, 1 month apart, so it's about a 3-month period. I do the platelet-rich plasma injection, also called the O-shot, at that
I was going
first
to ask
visit.
you about the O-shot.
Yeah, the O-shot is great. It really is. I do it on that first visit. I actually include it in the price of the ThermiVa because I know it lends so much benefit.
Can we elaborate a little bit more on the O-shot?
Sure.
And it was a twofold question, actually, because we were talking about having it redone.
Yeah.
Would that be vaginal rejuvenation? What is that we hear about?
So with the O-shot, that is the platelet-rich plasma technology that I started the conversation with. Platelet-rich plasma stimulates stem cells, no matter where you put it. So when we place it vaginally, we're actually stimulating the Skene's glands to create more lubrication. We're stimulating the collagen to thicken, so we're thickening the skin in the vaginal introitus. We are improving sensitivity because you're actually regenerating new nerves. And you can have tightening as well with just the platelet-rich plasma. Now you add ThermiVa to all of that, you get the tightening because of the radiofrequency. You treat the outside of the labia, so you get that labial tightening. You actually see a difference the first treatment. I have befores and afters. We take before pictures, then we take after pictures. So 35-minute treatment, 35 minutes later, there is a significant change in the look of the labia. The function then comes in the next couple of weeks. You start to actually experience some changes in function. Libido is really typically a testosterone issue, unless sex is painful, and then of course you don't want to have it because it's painful. Most frequently, women will have a decrease in libido as they age, but even young women, because of the stress that we go through, because of our poor eating, or not even poor, you might think you're eating healthy, but you're not. That could cause a lack of testosterone. And testosterone is a beautiful thing in women. We don't think about testosterone when we think about women. But women have more testosterone their entire lives than they ever do estrogen.
Never realized that.
And if you don't have enough testosterone around, you have low energy, you have foggy thinking, you have weight gain, you have decreased libido, you can't seem to make progress in the gym, you're losing muscle, you don't really feel like engaging in your life. Testosterone is a feel-good hormone for women. And it's very important when we talk about optimal wellness, and it's certainly important when we talk about sexual function. It doesn't solve all the problems. It certainly won't solve vaginal dryness. It won't solve urinary incontinence. But when you put it together with ThermiVa and platelet-rich plasma, the O shot, it's the perfect storm. And I've yet to meet a woman that we could not restore sexual function.
We have another question about who would be the perfect candidate for this. I mean, is this something for younger women or older women? What is the sweet spot, or is it for everyone?
This really actually is for everyone. There is no age that predetermines someone to be a responder or a non-responder. I have women in their 70s, I have women in their 80s that we actually do this procedure on, and they have benefit. I have young women that are suffering from pain, for instance, that's not associated with vaginal dryness. We can solve that problem. We certainly have young women that have urinary incontinence. It's really for old women. I have taken the most challenging women, not the woman wasn't challenging, but her problem was challenging, who they've had breast cancer, for instance, and they had years of hormone deprivation therapy. Well, you can imagine they're dry, they don't have good sexual function, they have difficulty reaching climax, intercourse hurts. There's all kinds of issues. There's lots of fear around what you can do, what you can't do. We have tremendous success treating those women. And we just apply these same tools in a unique, intelligent, regenerative way, and they get the wheels back on the cart. And life changes when you can re-engage fully in your life. Sexual function and having poor sexual function affects the family. And I've actually had men and women read my book and tell me that they had a conversation with their partner as a result of what they read in this book because they were validated. They did not feel engaged in their sexual life with their partner. That affected their intimacy, it affected their relationship, it affected their families, it affects quality of life for everybody involved. So women need to take responsibility for their sexual function. Women need to realize that this is an important issue. The urinary incontinence is an important issue. Your partners are missing that sexual interaction.
What's amazing is that this is a non-surgical approach.
Yeah.
And based on a question before, it can happen rather quickly. The change can happen rather quickly.
Right.
So it's almost like a miracle.
It's replacing surgery. It's absolutely replacing surgery. In fact, there's a lot of urologists, gynecologists, urogynecologists that are embracing this technology. These are surgeons. They're embracing this technology for a couple of reasons. One, you get surgical results, in many cases better than surgical results. Surgery doesn't improve sensitivity. Surgery doesn't improve dryness. You get the labial tightening, which surgery can improve. You get a non-surgical procedure with surgical results. And that's what people want. So these surgeons are actually embracing this technology.
So how often does this get maintained? If we see a change within a month, what is the maintenance, if you will, for the follow-through?
That's a great question. So the ThermiVa, we call it the Thermi-O, which is the O shot and the ThermiVa together, happens over a 3-month period. So it's 3 visits, 1 a month. What I typically will tell my patient is once we've solved your problem, let's go ahead and do 1 PRP Thermi procedure a year. So you don't have to go through the whole series, but let's go again and continue to regenerate. And the reason is, we have truly turned back the clock when we use these regenerative techniques, but the clock still keeps ticking.
Right, we haven't
So
stopped.
let's just continue to be proactive. And when you ask about who's the right candidate, I actually have women and men who come in for these procedures who have no problems. They'll come in for platelet-rich plasma because it makes sense to them that the clock is ticking. And we can be proactive and, take the necessary measures, which are non-surgical, non-invasive, not risky at all. And we can truly preserve our sexual function.
And I don't need a dollar amount, but what about the cost of all this?
It's very, very affordable. In fact, I'll just tell you, we charge $3,600 for the ThermiVa, the 3-session package, and I throw in the O-Shot, which is typically $1,600. So $3,600 gets you Play the Rich Plasma, 3 ThermiVas, and if we need a hormone cream to go along with that, that's not expensive. It's very affordable. Very affordable.
Yes.
We have another question. A 45-year-old Daniela, who's a single mom of 2 and is on the dating scene and really kind of wondering
Daniela.
if this
Hi, Daniela.
if this procedure, aesthetically will help. I mean, it's once you're that age, she's had 2 kids, and it's help her with this. She said.
Yes. Aesthetically, absolutely. Function, absolutely. And you're smart to think about those things because, let's face it. Sex is a very important part of a relationship. It's a very important part of beginning a relationship. It's a very important part of maintaining a relationship. It's a very important part of the happiness within a relationship. Yeah, so do it right. Do it right.
And she asked if there's any side effects.
0 side effects. 0. And no risk at all. So there's no reason not to do this, and we're getting amazing results. And doctors are embracing this throughout the country. It's not just me. Certainly, doctors are embracing this throughout the country. Why, you ask? Because the consumer wants it and because it works. That's why. Women are finally starting to speak up, and they're not accepting, sorry, I don't have anything here to help you. They're demanding that we come up with something. And we really have. I've been treating women quite successfully for a number of years.
Now, I know we're focusing on women, but what about PRP for men? What about if there is erectile dysfunction? What if Viagra doesn't work? What are some little solutions
For
that
men?
you can offer to men?
Yeah, men are a very important part of this equation, obviously. Men have a lot of different oral medication options, injectable medication options. Play the Rich Plasma works incredibly well for men. And it helps to improve sensitivity, it helps with erection quality, helps with stamina, helps with pleasure. It will help if you used to be able to use Viagra successfully and now it no longer works. Every time I inject a man who comes in telling me that, and we have another appointment in 4 weeks, they tell me that the Viagra worked again. So we're truly regenerating the tissue. And that's a big deal because a lot of men will start with the oral medications, and that's success. If you can take a pill and you can have good erectile function, then most men are happy. But then when those medications don't work anymore, what do?
Right.
It's really tough. Platelet-rich plasma will reverse that process because it regenerates the tissue potential. And that's where the book title came in. I had my first patient who, this was probably 5 years ago, he has cardiovascular disease, he has diabetes, he was using Viagra, Cialis, Levitra, and then they no longer worked, and he was bummed. So he asked me about Play the Rich Plasma. I told him I didn't know, I had never treated somebody in his particular situation. We went ahead and did it, since there was no possible chance of any risk.
Right.
We thought, why not? It made sense. Spoke in about 4 weeks, and he was absolutely elated. And he was excited because his Viagra works again. So that's success. Did I completely take him back to 25 years old? No, I didn't. That's okay. The reasonable expectation for him was that something would work and he would be able to have proper sexual function. And so now he comes to see me once a year, and I inject him every year. And so far, 5 years later, he's had great sex life, even though he has significant cardiovascular disease.
Another success story.
Yeah, really. There's so much that we can do that you have to look for these options. You have to continue to make it part of your healthy aging process, to think, these things don't last forever, so how do I become more proactive? How do I now use these regenerative techniques to reverse the damage? And it's quite affordable, and it's painless, and it's effective. Yeah. So, any more questions?
Any more questions online?
No.
Okay.
Other than where to get started, how to
Okay.
get started.
So doctorstudio.com is my website, and you'll find me in Boca Raton, Florida. I think that's probably the best way. There are whoever is not in Florida looking for this. I have a lot of patients that fly in for lots of different reasons. This certainly would be a reason to fly in. But there are other physicians as well. If you go to studioprp.com, you'll find other physicians that I've taught to use platelet-rich plasma. They may or may not have the ThermiVa. They may or may not do hormones, but they use the platelet-rich plasma technology. I think there are a handful of us who use all of these technologies together, and I'm really hoping to spread that. Nothing's a magic wand. You have to really understand the problem and then understand how to apply the technology. Yeah.
Well, thank you. We're very excited to have been here today, and we want to tell our viewers that we will have Dr. Roy every month on Facebook Live, and we will be discussing a little bit more in depth certain topics that we did a little bit of an overview today to just educate you a little bit as to what Dr. Roy does and her specialties. So tune in. We will let you know when the next one is, but we will be doing one a month and covering a variety of topics.
There's a lot to talk about.
A lot to talk about. And in the meantime, you can pick up Dr. Roy's book, Regenerating Sexual Potential. So thank you.
I just wanted to say any fabulous 50 readers that come in, we will always offer a free O-shot with every ThermiVa package. Right now that's a special, but if you come in anytime and you mention that you're a fabulous 50 reader, we'll go ahead and honor that special.
Well, thank you.
Thank you. I'm happy that
it
you
was a
came
pleasure.
in.
It
See
was
you next
really
month.
nice being here.